Well, mixed reaction today about the groundbreaking new research that's linking even low-dose birth control pills to breast cancer. That's something that could impact 16 million women in the United States.
Health reporter Stephanie Stahl is here with what local doctors are saying about all of this.
Lots of reaction coming in on this. First of all, no need to panic. Doctors say perspective is important. Hormonal birth control is still considered an important, safe option for many women. The increased risk for breast cancer is considered very small but meaningful. The new research found that women who took hormonal contraceptives, including pills, patches, and implantable devices, had a 20% increased risk of breast cancer. That translates into about one more case of breast cancer a year for every 7,700 women.
I was actually astonished to hear this.
Dr. Jennifer Simmons, the chief of breast surgery at Einstein Medical Women's Center, says this is the first significant research that shows even with relatively lower dosages, there's still a risk, and it was found to be higher the longer the contraceptives were used.
A woman in her 30s, if she has been on birth control pills for whatever the reason, I think that that person needs to strongly consider why they're on birth control pills. And if there is another option, I think that other option should be explored.
For many women, potential benefits outweigh risks. Hormonal contraceptives have been shown to reduce the risk of other cancers like ovarian, uterine, and colon cancer.
So we're not throwing the baby out with the bathwater. The birth control pills are not all bad, and they do serve a significant function for women outside of contraception.
And other risks for developing breast cancer need to be considered, the biggest being age.
Women should have a conversation with their healthcare provider about their overall family risk, their personal risk, look at weight, how that plays into it, exercise, nutrition. There are many factors that increase our risk for cancer.
Now, the study looked at data from nearly 2 million women between the ages of 15 and 49 over more than a decade. So it was a sizable study. But as that doctor said, any women who have concerns about this study, have a conversation with your doctor.
We always say health is very personal, so what works for one may not for the other.
Yes.
All right, thanks, Stephanie.